If you are enrolled in a Medicare Advantage plan right now, something changed on January 1st, and your insurance company was not required to call you and explain it. The share of Medicare Advantage plans offering over-the-counter allowances dropped from 73% in 2025 to 66% in 2026. Meal benefits dropped from 65% of plans to 57%. Transportation benefits dropped from 30% of plans to 24%. Three of the most popular supplemental benefits that seniors chose their Medicare Advantage plan specifically to get quietly reduced or eliminated effective January 1st, while most enrollees were still finishing their holiday dinner.
And beyond the benefit cuts, three of the largest Medicare Advantage insurers in the country, United Healthcare, Humana, and Aetna, pulled plans from counties and states across the nation. United Health stopped operating plans in 109 U.S. counties, affecting about 600,000 members. Humana cut back to 85% of U.S. counties and 46 states, down from 89% of counties and 48 states in 2025. Aetna will operate prescription drug plans in 100 fewer counties than in 2025. If you are one of the more than 35 million Americans currently enrolled in Medicare Advantage, this video will tell you exactly what happened, why your insurance company allowed it to happen quietly, what benefits you may have lost without realizing it, and exactly what you can do about it right now.
Subscribe to Nami Finance USA and turn on the bell notification. When your insurance company changes the rules, you deserve to know about it here, not when you show up at the pharmacy and your card gets declined. Let's start with why this happened, because understanding the cause is what helps you make the right decision about what to do next. The U.S. government has been cutting back payments to Medicare Advantage insurance companies since 2024. These are the payments CMS makes to private insurers for each senior enrolled in their plans, and they have been declining in real terms even as healthcare costs have risen. Bobby Hunter, who runs United Healthcare's government programs, said publicly, the combination of CMS funding cuts, rising healthcare costs, and increased utilization have created headwinds that no organization can ignore.
Here is what that means in plain language. Medicare Advantage plans make money by receiving a fixed payment per enrollee from the government and then managing care costs below that payment. When the government pays less, and when seniors use more healthcare than the plan projected, the math stops working. And when the math stops working, insurers have three levers to pull: raise the premium, cut the benefits, or exit the market entirely. In 2026, they pulled all three, in different combinations, depending on the plan and the county. It is estimated that by 2026, government reimbursement to Medicare Advantage plans will have fallen 20% from 2023 levels. That is not a rounding error. That is a structural reduction that forced insurers to make hard choices. And in most cases, the first thing that got cut was the supplemental benefits that seniors value most, but that are not required by law.
The word hiding in this video's title is deliberate. Your insurance company knew about these benefit changes months before January 1st. They were required to notify you through something called the Annual Notice of Change, a letter that should have arrived in your mailbox by September 30th. That letter contained every benefit change, every cost change, and every network change taking effect for 2026. Most seniors set it aside without reading it. Some never received it because their address on file was outdated. A few read it but did not understand the implications until their first doctor's visit or pharmacy trip of the year. The result is millions of seniors who enrolled in a plan for its over-the-counter allowance, its dental coverage, its transportation benefit, or its meal delivery, and who are now in January or February of 2026 discovering that the benefit is smaller than it was or gone entirely.
Let's be specific about what actually changed, because the picture is more nuanced than a simple across-the-board cut. The benefits that remain stable in 2026 are the core medical benefits, the ones required by law. Virtually all individual Medicare Advantage plans, 98% or more, continue to offer vision, dental, and hearing benefits in 2026, similar to prior years. If you enrolled in a Medicare Advantage plan for those three categories of coverage, your plan most likely still offers them. What you need to verify is the dollar amount of the allowance, the list of covered services, and whether your preferred provider is still in network. The benefits that took the largest hits in 2026 were the non-clinical supplemental benefits, the extras that plans added during the boom years of Medicare Advantage growth to attract enrollees, and that are now being pulled back as the financial pressure mounts.
The over-the-counter allowance, the quarterly flex card that seniors use to buy vitamins, bandages, pain relievers, and other health items at Walgreens, CVS, or through an online catalog, went from being offered by 73% of plans in 2025 to 66% of plans in 2026. For the plans that still offer it, the dollar amount of the quarterly allowance was reduced in many cases. A plan that loaded $250 per quarter onto a flex card in 2024 may now load $150. The card looks the same, the name is the same, the amount is not. Transportation benefits, rides to doctor appointments, went from 30% of plans to 24%. For seniors in rural areas or without family nearby, this is not a minor convenience cut. This is the difference between keeping or missing a specialist appointment. Meal benefits, designed to support seniors recovering from illness or surgery, went from 65% of plans to 57%.
There is a subtler change that most seniors will not notice until it costs them money. Prior authorization requirements. The number of services requiring prior approval before your plan will cover them has increased across multiple major plans in 2026. That means more phone calls, more paperwork, more delays, and in some cases, services that were covered automatically last year now require a waiting period and approval before your plan pays. Now, let's talk about what you can actually do about this, because the good news is that your options are more substantial than most people realize, and the enrollment windows are not all closed yet.
The first thing to do right now, before anything else, is find your annual notice of change and read the benefits section. If you kept the letter that arrived in September or October, get it out and look for your over-the-counter allowance amount, your dental coverage details, your transportation benefit, and your prior authorization requirements. Compare what it says for 2026 against what you remember paying or receiving last year. If you cannot find the letter, call the member services number on the back of your insurance card and ask them to mail or email you a 2026 summary of benefits. You have a legal right to that document.
The second thing is to check your current OTC balance if you still have one. Nearly half of Medicare Advantage enrollees, 46%, reported using their over-the-counter benefit, with usage rising to 55% among enrollees with household income below $50,000. If your plan still offers an OTC allowance, log into your plan's member portal or call member services and ask, "What is my quarterly OTC balance and what is my remaining balance this quarter?" OTC credits expire at the end of each quarter. Unused money does not roll over. Use it or lose it.
Third, and this is the most important step for anyone whose plan was terminated, understand your special enrollment period rights. If your Medicare Advantage plan terminates through no fault of your own, you typically qualify for a special enrollment period, giving you extra time to switch to a new Medicare Advantage plan or return to original Medicare. When your plan is dropped, your insurer must notify you in advance, typically by September 30 for changes effective January 1, and the letter should tell you when your current coverage ends and what your options are. Keep that letter. It may be required to prove your SEP eligibility.
If your plan was discontinued, your special enrollment period typically extends from October 15th through the end of February of the following year. After February 28th, you can still make changes through the Medicare Advantage open enrollment period, which runs January 1 through March 31. But after February 28th, you lose some of your special guaranteed rights that came with the plan termination. If your plan was discontinued and you have not yet chosen a new plan, act before the end of February. Fourth, compare your options using Medicare's official plan finder. Go to medicare.gov/plan-compare and enter your zip code. Every plan available in your area will appear, with their premium, their coverage details, their out-of-pocket maximum, and their star rating. Pay particular attention to three things: whether your current doctors are in-network, whether your current prescriptions are on the plan's drug formulary, and what the actual dollar amount of the supplemental benefits is, not just whether they exist, but how much they pay.
To get free, unbiased help comparing your options, call your State Health Insurance Assistance Program, SHIP. SHIP counselors work for you, not for insurance companies. They do not earn commissions. They will sit with you and go through every plan available in your county, line by line, at no charge. To find your SHIP counselor, call 1-877-839-2675 or visit shiphelp.org. Fifth, if you are considering switching back to Original Medicare, understand one risk before you do. In most states, if you leave a Medicare Advantage plan and switch to Original Medicare, Medigap insurers are not required to accept you if more than 6 months have passed since you first enrolled in Medicare Part B.
That means in most states, a Medigap company can reject your application or charge you more because of your health history. The exceptions are Connecticut, Massachusetts, and New York, which allow you to buy a Medigap policy at any time, regardless of pre-existing conditions. Know your state's rules before you make this move.
Here is the summary. 3 major insurers, United Healthcare, Humana, and Aetna, reduced or eliminated plans in hundreds of counties in 2026, affecting hundreds of thousands of seniors. At the same time, over-the-counter allowances, transportation benefits, and meal benefits were cut industry-wide because CMS reduced reimbursement payments by an estimated 20% from 2023 levels. Find your annual notice of change and compare your 2026 benefits against what you had last year. Check your OTC balance today. Unused credits expire at quarter's end and do not roll over. If your plan was terminated, your special enrollment period runs through February 28th. After that, you lose guaranteed rights. Compare all plans available in your zip code at medicare.gov/plan-compare. And for free, unbiased help, call your SHIP counselor at 1-877-839-2675. Your insurance company knew about every one of these changes before they went into effect. Now you know too, and knowing is how you protect your money and your care. Subscribe to Nami Finance USA so no benefit cut ever goes unnoticed on your watch.